Hi everyone, how are you? Welcome to another question and answer session. This is the question. A 45 years old lady develops severe back pain and on examination is found to have clinical evidence of lumbar 5 sacral 1 radiculopathy. Her symptom deteriorate and eventually a laminectomy is performed. During a posterior surgical approach, the surgeon encountered the tough ligament structure lies anterior to the spinous process. This structure is most likely to be. So in this question, they want to know that a tough ligament and this tough ligament is present anterior to the spinous process, and we have to find out the name of this tough ligament. Here the options are transverse spinal ligament, supraspinal ligament, anterior longitudinal ligament, ligamentum flavum, and posterior longitudinal ligament. So we have to find out one of the options, that means one of the ligament which lies anterior to the spinous process. So here first of all we can see this is the cut section of the spinal cord and the spinal column. Here we can see this is the vertebra, these are the vertebral body. Then here this is the spinous process and lamina superior articular process, and in this area spinal cord located. And usually during the surgical approach, these structures have to be cut. First of all, skin and superficial deep fascia. Then this ligament, this is the supraspinatus ligament. Here, this is interspinous ligament, and there ligamentum flava. So first of all, we can see this is posterior to the spinous process. This process is the spinous process. Posterior to the spinous process, there is ligament. This ligament is supraspinal or spinatus ligament. Then between the two spinous process, there is interspinal ligament, and anterior to spinal ligament, here the ligamentum flava. So the three important tap structure or tap ligament, it will have to be passed to reach up to this region where the spinal cord located. So here we can see this is the spinal cord here and spinal cord here, and from outside inward we can see the three ligament here. This is the first ligament, then second ligament, then third ligament. First of all, this ligament is the supraspinatus, then interspinatus, then ligamentum flava. And in the second picture also we can see here, and this is the spinal cord here. This is the spinal cord. So here we can see these are the spinous process, these are the vertebral body, and anterior to the spinous process there is the ligament, and this ligament is the ligamentum flava. So anterior to the spinous process, the ligament is ligamentum flava. Posterior to the spinous process, this ligament, this is supraspinatus ligament, and between the two spinous process there is another ligament which is the interspinous ligament. So our answer is now ready. It is the ligamentum flavum, because the ligamentum flavum, it lies anterior to the spinous process before the spinal cord. So the answer will be ligamentum flava. It is one of the tough structure or tough ligament which have to pass during the operative procedure. Thank you all.